Minnesota is going after Medicaid fraud, and they're using a bill to do it.
So what does this mean for people on Medicaid? News 8 Now's Grace Monk is in the newsroom tonight with some answers. Grace.
That bill would expand the Attorney General's ability to investigate Medicaid fraud. New staff members would be added to the Attorney General's Medicaid Fraud Control Unit. It would also increase criminal penalties and allow the unit to access financial records during investigations.
Most people who work in the program are doing the right thing. But the truth is, evil lurks in the hearts of men and women. And sometimes people commit fraud, and we've got to be there to hold them accountable when we catch them.
Current legislation defines Medicaid fraud as an attempted theft of public funds with a maximum sentence of 2.5 years. The new legislation would make that maximum sentence 20 years and include a fine of up to $100,000 for theft over $35,000. The biggest way providers commit fraud is falsely reporting hours and services.
So they'll say, well, we provided so a provider might say, we provided 20 hours in one day for Miss McGillicuddy, and they only did 5, or they didn't go at all. Or they might say that, they gave care to a fictitious person who doesn't even exist. But it really boils down to overbilling.
Medicaid fraud has a ripple effect.
It not only takes money out of the system, which is very bad, it not only takes money away from its intended beneficiary, which is very bad, but it also erodes the public confidence in programs like Medicaid.
For Ellison, the goal is to make sure people have access to the services they need.
Medicaid is a very important program. Low-income people who rely on medical assistance in Minnesota and like Wisconsin and other places really need it. It's keeping people healthy, getting them the care they provide.
And of course, the bill will need approval from the Minnesota House of Representatives and Senate. Reporting from the newsroom, Grace Monk, News 8 Now.